Good afternoon, Trish. So glad to be talking to you this afternoon. I know that we have spoken many times, and I think we were first introduced when we were doing a Giving Tuesday campaign about 4 years ago.
Yeah. Yeah.
Oh, so glad to have you. Let's start off just by kind of introducing yourself as well as your diagnosis.
My name's Trish, and 2019, it was September, being Ovarian Cancer Awareness Month. Always ironic that I found out that I had stage 3C ovarian cancer. At the time, and she's been my doctor for 20 years, was seeing, she does Eastern medicine, Western medicine, and she was the first one that I saw and said, hey, let's get an ultrasound. There's something going on here. And she also said, there's this book. She goes, we don't know what's going on yet. But when we did find out, she gave me one of the top oncologists in Colorado down at UC Health in Aurora, and a book called The Metabolic Approach to Cancer. So I had connection with conventional oncologist down in Aurora, and I had her, and she was very mindful about how this all came about. And I think that's having that foundation of, I was never scared. I was never pushed it away. It was just information. And especially after reading The Metabolic Approach to Cancer, because it gave me this huge empowerment of like, I can't do anything about this diagnosis, but I sure as heck can do something about these next steps. And I had both working together as a team. I did do the standard of care. I did chemotherapy, I did surgery, I did oral chemo, but during that whole time, I was getting this beautiful host care. And after like reading the Metabolic Approach to Cancer, she was helping me with my terrain while I was going through these chemo sessions. I had total 12. So it was like 3, then I had surgery, and then I had 3 more. Then I had about 18 months on oral chemo. And then I call this like, it was just this cantankerous spot on my liver that just kept popping up, like, those candles that you blow out at your birthday. And basically it just was like, it was gone, it was here, and it was gone. Ironically, now that I know, it's just like cancer can live in me, and it was probably always there, not ever gone. But when it started popping up, that was just where I was out of balance, and we still just needed to tweak the recipe and, look into my terrain and look into see where it was that I was out of balance. And a lot of it was my hormones and toxicity. And so we took a deep dive in that. And here it is 5 years later. The labs that we did, always the test, assess, address. We tested, we assessed, we addressed, and we saw kind of specifically where we could navigate back to where I could get back into balance. And a lot of times, I hear in the in the conventional world, it's, well, we don't know how you got it. So, we'll just kind of cross our fingers and good luck, even though they want to do the best they can to get rid of it.
Right.
And so that's where, it was just this beautiful space where I was just like, oh, okay. Because if I knew how this happened or why it happened, I was like, well, I'm not going to do that again. But there's no like direct A to B type path. It's this living, breathing thing that is always consistently changing. It's just like you have the recipe, but I always had faith in a plan. I always knew that there was a plan. Like if something didn't work, okay, let's still try to investigate and continue to find out where it is that I needed support to find that harmonious balance again.
Yeah. So now you're 5 years post your diagnosis. Let's go back to before your diagnosis. Did you have symptoms?
I did. And they all mirrored menopause. And because there's everything kind of equated, it was just my mom went through early menopause, and I had incontinence. And so when I went, it was just like, well, a lot of times the pelvic floor, you need to, sometimes after you've had kids, I had 2 kids naturally, worked on the pelvic floor, and things got a little bit better. Relations with my husband were painful, and then they got more and more painful as time went on. And
Which happened to us.
yeah. And so that's what really brought me into the doctor, because everything else made sense. It was just like, all the, some of my girlfriends, they were, yeah, it just, the incontinence, and then you have pelvic flooring work. And I did that, but it was mainly, yeah, I had those kinds of symptoms.
And so you went into the doctor, and how did they initially diagnose you? Was it through lab work or through imaging or a combination of both?
It was through imaging. So I had a ultrasound first. Well, and just a physical examination, and then an ultrasound, because my doctor that I've had for 20 years, she says, there's this, I would like to get some imaging. And within a matter of 2 weeks, I had imaging. I was down at Anschutz, basically seeing the oncologist down there, and he said, yeah. And I didn't know this at the time, but it's atypical for you to have two tumors. I had tumors on both ovaries. Usually I hear it's like you have it on one or the other, but it didn't matter. It was what it was. And so we all agreed as a team that yes, we needed to address this, because it was just growing like
Yeah.
wildfire.
And did you have surgery to remove those tumors?
Yes. Yeah.
Yeah.
So we
Surgery.
started, yeah, it was just, the protocol of you do to shrink the tumors, you do the chemo, and then you do the surgery, and then 3 rounds after, and then everything was fine. And then I was on oral chemo because that came as an option. And then things, started growing again. Then I went through and did another 6 rounds of chemo. And right about that time, I really got connected with Dr. Nasha Winters.
And then she did kind of the complete metabolic health assessment. Can you talk a little bit about that and what that process was like?
It was incredible, because it was at the time, it was just like, my doctor of 20 years and Dr. Nasha, I was fortunate enough for her to see my case, because we went raising money for her foundation down in Arizona, and I won that lottery ticket. And it was meant to, it was very fortuitous and right at the right time. And at the whole time, it was just like, if this is too overwhelming, and it never was. I was thirsting so much for this information that, and just knowing that in over the past, and we're still continuing. I mean, we had a whole house filtration system. We have air doctors. We got a sauna, and not that's just just a small part of the checklist, and just lifestyle, and low fat, high. I mean, not low fat, high fat, low carb,
Low carb.
moderate protein. The ketogenic lifestyle. But even with even under that keto life umbrella, it's still very specific to me, like what works, and just again the testing, assessing, and having the tools, the Keto Mojo, and logging things on I use the Carb Manager. So it was just this beautiful list that Dr. Nasha came up, because she had seen everything, and as she does, she took a deep dive and just saying, this is where we see you out of balance. And here it is 5 years later that, I had lots of tests that were high. My body just couldn't handle. Well, I don't know how a lot of people can handle toxins. And I'm learning that more so, that people are very different, and some people can handle toxins more than others. I just couldn't. My body was very sensitive, and I wasn't kicking it out.
Yeah.
And so,
that's one of the things that's unique about Dr. Nasha's process and the doctors that are in our network, is that they actually test for the toxins, test to see exactly which toxins are in you, so that you can investigate and see potentially where those exposures are coming from.
Yeah. Yeah.
Which is so critical. We just don't know. And sometimes we're exposed to things that we have no clue we're exposed to. So, knowing what those are it's just all about empowerment at that point. And that's why it can become overwhelming for people, because when they're first getting a health assessment from Dr. Nasha or one of the practitioners in our network, and they're going over all of these possibilities of things that could be playing out and the things that need to be done to fix it, it can be really, really overwhelming. So the fact that you didn't get overwhelmed tells me that you likely weren't in a state of fight or flight. Was that something you had been working on, or do you think maybe you were in a state of fight or flight?
I think I'd always been working on things. just constantly, because I just, running from the tiger is just, it's exhausting. And I truly believe that this came knocking on my door. It's just a God thing, just saying, because there was all these things, and I thought, okay, I was doing this, and I was running marathons, and I was doing triathlons, and I was volunteering at the school, and I was opening up a new school, and it was just go, go, go. But all these things that I thought I was doing to help, but what I was doing, physically, I think it was too much stress on my body. And, it took cancer for me to realize, like, you were just doing too much. And so, even that balance. And so I think, that magical question of, were you healthy before you had the diagnosis? I honestly would say, if somebody asked that before, I would say yes. But of course, it's like, how nobody's really truly 100% healthy. It's just
Right.
some people are healthier. But, and the very things that I thought I was doing right, the diet, I ate 20% of the time, whatever I wanted to, and 80% I ate a clean diet. And now it's just, oh, no, you can't, it's not 20/80. It's got to be, pretty much 99, 100%, or at least 95, 5% type of thing. So I was, keeping in check, and just even through all this, I was just like, I don't do overwhelm anymore.
Mm-hmm.
Because I was in this space of, I was waking up at 5 o'clock in the morning, and I was working out at this, high endurance place, which was, at the time really, really amazing. And I was getting in great shape, and, and opening up this new school to help other, it's like a strength-based school, because I have dyslexia, and both my kids have dyslexia. And so I was trying, and here I was just kind of doing all these things that I thought were helping the world and my kids and myself. And it was just, I think I was in that space, and I didn't realize how probably that I was, very much stressed,
Yeah.
physically, mentally, and emotionally stressed, for sure.
Yeah. We take on so much and we don't realize the significant toll that it takes on our body. It's like any, stress, physical, emotional, and anything that we're applying to our cells. I mean, we have to remember we're not just one organism, we're a bunch of organisms.
Yeah. Yeah. And it took, the diagnosis to just physically stop me, just because even, in that acceptance piece, I was, sometimes I was like, well, I can still volunteer in the classroom. I can still be the room mom. And I was just, and everybody was like, no, you have to unvolunteer. That was my first job. Unvolunteer from everything. And I did. And I said, and I put everything I had into my health and healing.
Oh, good. And now how is it? Are you finding a good balance, or is it something you're still working on?
It'll be a work in progress, like probably for the rest of my life. But I now physically have that energy of like, oh, I notice those signs. I'm like, you can say no. You don't have to, it'll be okay. And just putting my health, because without my health, um, it's huge. I don't want to be in that cancering space. And I can't remember if I heard through the MTIH community of like getting off the treadmill. I said, I want to get off that treadmill. I don't want to keep having this crazy cycle of just like it coming, I want to learn how to make my body inhospitable to cancer, so
Yeah.
that I can be healthy and do the things and live the life that I want, not just being stuck in doctor's appointments and trying to figure out the next recipe and stuff. To have this harmonious type of lifestyle where it's not, I'm running from the tiger. It's not too much. It's not too overwhelming. It's just this wonderful, like adventurous, but with peace and calmness that comes with it. That I don't have to go and then rest. I can just do, and then listen to my body, and it's just it's a beautiful balance of how,
Right.
yes, it's way better than what it was 5 years ago.
Oh, I love that. I love that. And are you still sticking with the methodology that Naisha applies as the test, assess, address, and she loves to do testing every 30 days. But once you get kind of further out from that diagnosis and you're more in kind of management modes instead of in the cancering process, you can go out to every 3 months or testing. So how are you managing it now?
We're working with both my doctor, conventional oncologist down at Anschutz, and Dr. Fields, who is here in Fort Collins, my doctor, 20 years. And we have Dr. Dudley, who is in Tennessee. So I have this triad of three doctors that it's just saying, let's collaboratively, yes, let's see, do these tests and, what is pertinent, what is, if we do these, if there's some tests and things look a little bit funny, let's dig a little bit deeper.
Right.
But for the most part, and what's great is I am bamboozling my doctor down in Anschutz because he's just, I said, I keep coming in. He goes, let's just, do what you're doing. And he is welcoming all these other therapies
That was my question. Is he receptive to it?
very much so, very much so. And the fact that like, he wants to see his pictures and he wants this. And I said, well, since we've been in this for 5 years, you know what I've been doing? Like my markers are, and my blood work is, they're really good indicators. So if my numbers come back and they're good, there's no reason for any scans, so I can decrease that, and where we don't have to keep doing scans all the time. So he's like, okay, we'll table that, and yeah, we'll use your numbers and let's just go from there. And it's just not just my numbers. We're not just looking at the labs. We're looking like a lifestyle and how I'm feeling and my energy and what's my, the whole picture, not just my lab.
That is truly, truly amazing. It's hard to find doctors, as you know, that will be on board with this, standard of care oncologists that will be on board with this. So it's nice when you can have a team and you can be transparent with that team, because that's what we really want to strive for, is transparency and acceptance. And the understanding to be able to support on both ends. You wouldn't expect your integrative doctor to know everything about ovarian cancer, and you wouldn't expect your ovarian cancer oncologist to know everything about the entire body and the entire terrain. So if you can get good supportive doctors, that's ultimately the best. But a lot of people have a hard time doing that. And I have some questions around that. Was it hard in the beginning? Did it take some coaxing? Are there hurdles that you had to work over, or was everybody kind of on board from the beginning?
So there were a couple, there was, of course, especially during treatments, because they know what they know. And it's just like this tunnel vision. They have this vortex. It's just like, this is what we do. This is what we know. And then you have this other stuff. It's like, what do you mean you're taking that supplement? Well, that's an estrogen type supplement, sometimes the mushrooms and things of that sort. And even though we know that mushrooms, just the supplements are very helpful. That's just an example. And they were just like, well, let's not do that right now. So it got to the point to where they just kind of had their little list of things. If you are taking any of these, it's going to interfere with the chemo. Right. At the time. And another, I fasted the day before, the day of, and the day after during all my treatments. Even just this latter, I was able to do immunotherapy, and I just used the same mindset of I did this, and where the body is just so receptive to whatever therapy it is, whether it's immunotherapy, whether it's chemo, whether it's the high dose vitamin C, hyperbaric chamber. It was just a lot of of that intermittent fasting, and that fasting just, I truly believe, just helped those treatments work way more better than if I was in a non-fasting state.
Right.
But yeah, it was. And so it was just, it just took a little bit more, and it just being more open and being vulnerable, and just saying, and not fighting it. I'm just kind of being very calm and talking to them about it, and just going, and really remembering at the very beginning that I'm the CEO of my health, and they can suggest things, but it's just like, we're constantly, I tease, I was like, we're just this giant science experiment. I said, let's just see what works and see how I'm feeling, and look at the numbers, and maybe, with everything that's coming, this little shift, and it's just like, oh, okay. And one thing it was just said, it's just, a lot of people may prey on cancer patients. He goes, I just don't want you to get bamboozled by anybody. And he goes, because all these other things, he's like, I just want to make sure that, you're doing all this stuff and not to get taking advantage of.
Yeah. 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 From other doctors who, there are on all sides of healthcare, there are doctors that might prescribe things or recommend things that, are not needed or might be charging for things or doing things for financial reasons. And I think that can happen across the board, across any board. So it's about knowing who you're working with and feeling comfortable with them, which is completely understandable. Um, Question, were you given any type of diagnosis, end stage diagnosis or life expectancy diagnosis?
No. When we first went to that first oncology appointment and we had the physical exam, and then we went to go into the office and talk, and we heard cancer. My husband actually asked he goes, how long does she have? And I look over at him, I'm like, what are you, like, what? And I'm like, oh, he got to ask, the big question. And so from the very beginning, he said, everybody's different. There's statistics on there. One thing that he said, don't go online. But I never had like, you have this. So I really never had a prognosis, and of anything. That just in my whole energy, my whole being at the very beginning, I knew that this was not going to be something that was going to be terminal or anything that I was going to have a problem with. I wasn't, no.
Didn't matter.
So,
and
yeah.
For somebody who might be listening to this, who is looking at the statistics, do you have any advice?
That this diagnosis, whatever diagnosis it is, it comes knocking on our door. It's very personal of how we got it. And so it's very personal and very individualized of how we go back to stop it, to get rid of it. And so, there's all these things, if you do see the statistics, I'm like, well, they weren't this old. There's just so much out there it's just kind of a general, and it's not
all the averages. It's not indicative of any one person.
Yeah. Yeah.
Yeah. That's beautifully said. Now, do you mind, would you mind sharing your oncologist names that Ann shoots, so that if somebody does have this diagnosis and they're potentially in Colorado, that they would be able to maybe get a consult with them?
Of course. And what's really great is in November, they just opened up it's the Colorado Innovative Ovarian Cancer Center down at Anschutz. And so it's Dr. Guten Polly, which is super fun to say.
Yeah.
And Dr. Sacketh's Guten Polly. And I was even be able to go behind the scenes to see where all the labs are. And it's a research, proactive type environment. Even the person that was in the labs, they're saying we're gearing into seeing all these different things that are coming about, and maybe not having chemo, surgery, and radiation as the front lines of treatment. That there's these other things that they're folding in, and so it's. When I asked him, I said, okay, what about the integrative piece to the center? And he says, just not yet. And I get it. There's phases and there's ways that things can roll out. And, and we've been working together and been working with the nurse advocate down at Anschutz. And we're really, what's great is, there's a lot of red tape with big university things, cancer centers like this. But the fact that, that they're not shutting the door to when I first said, what about the integrative piece, is beautiful, because, they're opening up. They're just like, oh, let's treat the person, not so much the disease. Let's, I think that's at least in my own personal relationship with Dr. Guten Polly and the team down there and my team here. That's the direction it's going for me. So it's like at the beginning, like when you said, I was like, things are changing. I like had a pinky toe in the door, and now like I have a whole foot, so eventually I'll just be all in there. And, things are just this movement of people getting personalized medicine, especially with cancer, is for sure changing.
Yeah. Yeah. I mean, there's so many things that has to change. The systems have to change. The processes have to change. The education has to change. But you have taken our education program, the Terrain Advocate program, and I know that you have been able to use a lot of what you've learned in that course in your conversations with Anschutz and with what they're building out. Ideally, what would you see happening in the future?
I think it would be to where there's almost like the knowledge and the information that I was gifted at the very beginning, because honestly, I did not know of Dr. Nasha Winters or the metabolic approach to cancer had my doctor not hand this book and put it in my hands. And so just having the bridge of, a beautiful, kind of relationship between conventional and integrative. And I think eventually I said, hopefully, I don't know when, but it's just going to be medicine. It's just going to be, to where people that get a diagnosis and then they can have the resources that lie in both camps, or all camps. It's just, so that they can, not feel so helpless. They can be empowered and the information is going to be there. It's not, because a lot of it is lifestyle. A lot of it is very personal. And so it's not like there's any huge thing like, the Terrain 10, it complements the conventional ways to treat things. And so I think eventually that's where my vision is. We're not going to have these specialized individual things of like, you got to go here, you got to go there. It's just, just like down in Arizona, hopefully, with Dr. Nasha Winters, the foundation there and the hospital, it's just going to be all together. If you need to do this, let's do this, but let's support you in this way. So I think
term of complementary and alternative to me just does not work, because we're thinking complementary to the person. The cancer is actually, what is complementary to the body, and we're more focused on the tumor and the cancer cells than we are the person. And so it shouldn't be that having an integrative approach or adding in some of these additional diet and lifestyle changes are complementary. That should be foundational. And I see a world of integrative metabolic oncology and integrative medical health that is truly integrative and metabolic in function, because the majority of diseases are metabolic diseases. And people need that awareness. They need that education. So often we think that if there were answers beyond the traditional chemo, radiation, and surgery, then the doctors would know about it.
Yeah.
But they don't. That's not what they went to medical school for.
Right. They know what they know. And then, but the fact that, just that willingness of learning more as things unfold is going to be very impactful, and for the longevity of this, and more people can live with cancer and have a very long and healthy life because of the foundation of, one, seeing the right doctors, how it's being treated, and and just know that, I just remember with Dr. Nasha Winters when it said, I much rather cancer be in you and your labs be really well, like the trifecta labs, your LDH and your C-reactive protein and your ESR, just those ones. It's like, have your labs look good, because your body's in charge instead. But I think, seeing with the lens of a conventional person, they see it and then it's their job to kill it at all costs. And I think the fact is, we can live with cancer in us, as long as it's not taking over, and that we just keep, it's just going to be this thing. We're just got to keep it in check, and not just go, well, I have no evidence of disease. And then, 10 years later come by and it, pops up because nothing was changed or nothing was done. So that was one thing my Dr. Gooden probably said. He goes, you're going to be just fine. He goes, because you're on this and you are, you consistently are getting checked and doing your testing and making the changes necessary for this, to have a long and healthy life with all of this.
That's the best when you hear that. And when your oncologist has confidence in you, that gives you the confidence that you need to say, yes, I am supported. I am supported widely and in a really nice, healing way.
Yeah.
And so tell me, how do you feel now than prior to your diagnosis? Do you notice a difference in how you feel? Do you feel better? Do you feel worse?
100% better.
Mm,
Like it's so weird to say that I'm healthier now than I ever have been in my entire life. And I think it was just, um, I'm just, if anybody sees this, I'm just hoping that they don't have something like cancer to where they have to, go back and balance. Like, the number one way that we can cure this disease, cancer, whatever it is, chronic illness, is prevention. And so when our bodies, like cancer is just my way. Sometimes people have migraines, sometimes people have autism, some people, allergies, all our bodies are just, they're not meant to be sick, but they give us these little signs that say, oh, your things aren't right. And
crank
um
all the time.
yeah, and so but it's just a lot of people want to shut the door. They don't want to know about it, and which is fine because change is hard. And if but to be willing just to go, oh, why is this happening? And then you just go back and, but according to my tests, and everything that I've seen and how I feel and my energy and my sleep, oh my goodness, yeah, I'm healthier now at 48 than I think I've ever been. Yeah.
Ah, that's nice. Would you, on a scale of 1 to 10, how would you rate it? One being low, 10 being high. What do you think your quality of life was before your diagnosis?
I think the how I feel now, I would say a 7, and yeah, I would say a 7. I would say a 7. Um,
7 now or 7 before?
7 before, and I believe, I 10 is. I always say it's just like, okay, I'll give a 9 because 10's like a 10's a 10, and I said there's
Yeah.
got to be room for growth. But I
Yeah.
could still say a 10, and I could still grow. I can go up to an 11. There's
Right.
how my mind works. So um, growth definitely, and this is not the stopping point. I will continue to learn and grow because I'm going to be constantly changing. Life is going to be that's one constant in life, right, is change. So um, I gotta just roll with it and kind of tweak things as we go along.
Yeah. Yeah, for sure. And what else, kind of in parting, what else would you say to someone else who's just getting diagnosed and is listening to this and is feeling lost and confused and potentially in fight or flight, which is a really, difficult place to be? What advice would you give them?
That this is a very survivable disease. Um, it it takes a curiosity and courage to find what's why it's happening, and time, and just it didn't just appear. So from what I know, it can take up to 10 or more years to manifest. And so as a society of we want things to be, let's just do this and let's get it gone immediately. um, we have time to breathe and stop and um, really get a good team behind you and then proceed forward. Just, try not to, it's super, super hard not to get into this vortex of this fight or flight. Like it's cancer and
Yeah.
we got to do this. And why are we still sitting here? Why can't we just get this, let's get this thing going. Um, so I think, yes, it's very survivable as long as, because when we don't want to feed it with fear, we don't want to feed it with negative things. It's just like, let's just approach it and surround yourself with healing stories, the radical remission, and just, because you will always encounter people that, it's my dog's brother's owner's roommate who took this and you just, they're cured, or, you take these supplements, you just keep assessing and addressing your own statistics and going from your own stats, because at the end of the day, that's the best information that we have. And when we can sit in that space of just being calm and breathing and just doing next steps, this is it just, you become in a healing space. Yeah, for sure.
Yeah, I mean, and just I just want to emphasize what you said is because there is so many Facebook groups. There's Facebook groups or groups for ovarian cancer, for breast cancer, and you go in there, and again, it's the averages. So it's somebody saying I took Rick Simpson oil and that worked for me, and then everybody's going to go take it. That might not work for them. Or I took this and that worked for me. Well, you don't know what all other factors, unless you were looking at a database of that person and all of the things they were doing, how they were living, how they were eating. You can't apply and say one therapy is what did it for them.
Right.
That's
Right.
the hard thing, is because you want answers. What's going to work? What tool have I not looked at? Or what tools do I have in my toolbox that I can throw on it? It's really hard not to get sucked in that, especially when you're in fear for your life.
Yeah. Yeah. 100%. Yeah.
So thank you for saying that. I appreciate that, because that's one of the biggest things that we see is, we get patients that come to one of the doctors, or Dr. Nisha or Dr. Alsaka, and they just want to throw everything at it.
Yeah. Yeah. And I'm just even noticing after, going through the program and being a certified, metabolic, MTIH advocate, ideally, just working with people, and you have this list of tools, and I'm just noticing more and more, it's just like, I can't just take this and go here, do this, just talking one-on-one with somebody. And it's just like, oh, these are the tools that, and not all of them at once. I'm just saying, just start with the top 3 and let's just work from there. And it's different from every single person. It's just like, oh, this is maybe what they need. And I said, I have other ones, but we're just going to take these baby steps. But it's very individualized, and how, what tools would work best for that individual.
Yeah. And so now, truly in closing, is that what your future looks like, working with individuals who are dealing with a cancering process? Are you going to become a full-time advocate, or what does that look like?
Yes. Yes. I think from the very beginning, I knew deep down that this was something that I was going to thrive with. I just did. And I would not be doing, just being an ethical human being, not to pass this information on.
Yeah.
So yeah, 100%. At the very, when I first really got that diagnosis, I said, wouldn't it be great if I skated by where nobody knew this? And it was just a moment in time. And I was just like, no, I want to share this with whoever is willing to take those steps. And yeah.
That's amazing. It sounds like cancer is your gift, and now your cancer will become other people's with cancer gift as well, because you'll be able to pass this forward and to help them.
Yeah. And it's just, and yeah, all the little details, all these little tools, but mainly a friend of mine said, she goes, when I talk to you, she goes, I have hope, and I actually, it came to me a long time ago, hope being an acronym of healing, optimism, perseverance, and educate, because healing you can be healed. To be, optimistic turns into opportunities, and to persevere, it gives you purpose, and to educate, it gives you this empowerment. So hope has a whole different meaning for me, not just the word itself, but just, just this energy of things can change, and they can change for the better, for sure.
Oh, I love that. I love that. Hope. Such a good way to. Well, thank you so much, Trish, and I look forward to many more conversations.
Yes, you too. Thank you so much. This was an honor, truly, that I get to share this.
Yes.
So, thank you.